Hello and welcome to the X Factor podcast. I am joined today by Dr. Molly Pachan. Molly, hey, how are you?
Hi, thanks, Charles. Nice to be here.
Yes, I'm really looking forward to this conversation. We had this great initial exchange over LinkedIn, and we continued that. So I'm really looking forward to this. Molly is a clinical psychologist whose work focuses on collaborative assessment and treatment of complex co-occurring conditions. Her interests include psychodynamic psychotherapy, mentalization-based therapy, and the intersection of artificial intelligence and psychology. An intersection, of course, is dear to our hearts here. Molly is a clinical psychologist at the Lindner Center of Hope and assistant professor of psychiatry and behavioral neuroscience at the University of Cincinnati College of Medicine. So, again, thanks so much for taking your time. By the way, just random free association. I associate University of Cincinnati with two things. One, I believe that's where Sandy Koufax was recruited to play basketball. Obviously, ultimately became a pretty good pitcher. And of course, the Kelsey brothers, right? Jason and Travis Kelsey. I'm sure there's a lot more to say about University of Cincinnati, but I just had to say that. Anyway, again, Molly, thanks so much for taking the time. Really look forward to this conversation. So I'm always curious when people come on the pod, what drew them to their line of work? What drew you to this particular line of work? Was there some motivating factor when you were a younger version of yourself?
Yeah, I think most psychologists probably think a lot about what drew them to this field. It's kind of an unusual thing to say, I want to grow up and listen to people talk about what's upsetting them. And I think for a lot of psychologists, I'm probably in the same mix as them. I was always fascinated by stories and understanding people and the misunderstandings that can
Mm,
happen. So that was always something that I think I wanted to challenge myself to understand. And I loved the blend of science and intuition and art in psychology. So just it checked a lot of boxes when I was looking into like what to do with this life. Yeah.
yeah, that is interesting to look at it as science and art because ultimately it is an interpretive uh, undertaking. Um, in our initial exchange, again over LinkedIn, you mentioned that you were a psychodynamic psychotherapist, which I mentioned in your intro, with a particular interest in how the talking cure is actually the healing relationship. And you use the term intersubjective space to describe this relationship. First, what do you mean by intersubjective space? And what is the talking cure and how do I get some?
Yeah. So the talking cure is really what Freud and colleagues started discovering back over 100 years ago, realizing that there were things that couldn't just be fixed with a pill or a potion, or with a prayer. That there were ways that humans needed to interact with other humans to address some of what ails. When it comes to intersubjective space, that's something that has been developed over many decades in the psychoanalytic and psychodynamic literature, thinking about what exactly is it that is healing about talking about problems. There's this sense of like, okay, get it out, and there's a release and a catharsis, and then what? And why do you need to do that with a human? In some cases, it seems like that has a much bigger impact than if you were shouting at a wall, for example. So that intersubjective space is when two or more people are connecting on something that is an important topic to each of them, and they're tuning their attention in and understanding it with their own perspectives. And this intersubjective space in the middle is a co-creation of that. Now, everybody does this. It's not just something that happens in therapy. This is how humans learn to interact. So even babies and their parents in the early stages, like primary caregivers, are engaging in an intersubjective experience where there's an attunement before a baby can even explain with words what they're experiencing. So that intersubjective space is something that you do all the time. and that most humans do very often. We're all born with the capacity to tune into intersubjective space to some degree or another.
Right. This is a point we're going to come back to. And it's kind of interesting. Again, our initial interaction, when you sort of unpack this for me, your initial thought was, well, maybe this is not a good topic for your podcast. I said, no, this is precisely the kind of stuff we want to talk about. We're not always biased in favor of AI or apologists for AI. I like to take sort of an agnostic position, just hear different voices, different perspectives. So what you're talking about is very important in this conversation. It's vital, in fact. And, this obviously tees up the rest of this conversation, the intersection of AI and psychology, which again, in the intro is clearly a good focus of your work. And yeah, you just sort of touched on this, and I'm quoting you here. AI is trained to attune and adapt. This is something you sent me in an exchange we had. AI is trained to attune and adapt, but it cannot form a true relationship because it is not an actor. People anthropomorphize AI agents, but agents are not actors. We as a culture need to understand this and explore it. I think I might have shared this with you. It's kind of interesting. My daughter was experiencing some anxiety. She was preparing for a very important test, which plays a big role in determining where she's going to be matched to a residence. She's in med school. So she sought me out for some counseling. I'm her dad, after all. I could at least do that, I think. Her boyfriend, her therapist, and last but not least, ChatGPT. So after this, I said, Kayla, but of course, as your dad, my insight was the most valuable. She goes, well, Dad, I hate to break it to you, but it was ChatGPT. And, apparently ChatGPT gave her some good advice and a really good practical strategy. And so I guess my question is that, um, is empathy or can empathy be put on the same level as empathy? If you could calibrate an LLM, a chatbot, to express empathy, to portray empathy, to simulate empathy, is that good enough, or is that intersubjective space that important? What I would call the ghost in the machine, that human element, is it so irreducible and so woven into our fibers, our thinking, our feeling? That's kind of a question. I apologize for that.
Yeah, there's a lot of good questions there. Yeah. Well, first of all, your daughter's obviously very smart. Not only because she asked you for advice, but because she went about this in a way that she kind of got all of her needs met.
Mm.
So she said, "Well, actually, sorry, Dad, ChatGPT was the most beneficial, and it depends on what you're looking for." It sounds like at the point that she reached out
By
to
the way,
you.
Molly, just let me just interject. She wasn't always this good at letting me down so easily. But go ahead.
Ah, okay, okay.
Yes.
So your intersubjective space has shifted as she's matured. So
Yes.
yeah,
Yes.
yeah. And maybe
Exactly.
maybe you've matured a little bit too.
Yes.
Yeah. We as parents tend
Yes.
to learn as we go along too.
Yes. But we digress.
Right. Um, so she used each of those resources, you, her boyfriend, her therapist, and a chatbot for what they really are good for. So by the time she reached the chatbot, it sounds like she had some of her relationship needs already met. She knew you support her, the other people in the loop support her, and she'd already kind of filled that need and then needed some practical skills. And AI is great for tasks. So if you ask AI, design an anxiety coping strategy for me for this big test that I have coming up and give me tips and tricks and a schedule of like when I should use these things. It would be really good at that because there's a lot of free information available on the internet about that already. So AI is really good at tasks. Humans are really good at relationships. AI is not very good at relationships. I argue that it's not. I argue that AI expressing empathy is a mimic of empathy. AI is really good at mimicking human created content or other, it can be human and AI generated content. It's really good at mimicking other things that it's read or seen or the data that it's taken in. It is not great at attunement, although it's getting better, and it cannot form an attachment. And so that's a really interesting point. You can argue, do we need an attachment? I think you can safely say at this point in human history, we do. And I think if you or one of the other people in that loop had said all the same things that the chatbot told her, she would not have liked it.
Yeah, that's a very good point, and I didn't think of that. That you can't really isolate the interaction she had with ChatGPT because that was already in the context of several other human interactions. So she came with it, maybe not even thinking about it. And I asked her as though it was sort of zero sum. It's either this or that. But it's not either this or that. It's all of it. So
Right. It's kind of like saying, well, where did you find that thing that you couldn't find? Well, in the last place that I looked.
right, right, yeah, no, that's a really good point. But what about what's behind, people do develop these attachments to chatbots. We know that that's a problem. Now you're doing some work right now. I'd like to talk about that at some other point about, I guess, AI and loneliness and or just interaction or being immersed in a digital world and how that promotes a certain loneliness. That's really an interesting very interesting topic. But, some people, as you well know, develop I'm gonna editorialize and call it an unhealthy relationship with a chatbot. So they're getting something out of it, and that is a situation where it is kind of zero sum. They're not necessarily interacting, and that's part of the problem. They're not interacting with people. They're interacting almost exclusively with their chatbot. So it is fulfilling some need. And as this technology evolves, it may get, as you say, better where there's where the difference becomes almost vanishingly small. It's sort of like the difference between a lab grown diamond and something that was extracted from the earth. Technically, there's no difference. The only difference is that one has a certificate saying that this was uh, naturally made. The other one was it was created in a laboratory. So again, I know that's an elaborate statement that implies a question. I don't know if there's necessarily an answer to it.
I think that's a really good comparison, actually, that there are naturally occurring resources which are limited and maybe rare, and there is a great need for some of those resources. And then there are synthetic replacements or augmentations that are maybe appear under a microscope to be almost identical, if not identical, or maybe even more perfect than the one that you could find naturally. So then why do you think that synthetic diamonds are less expensive, less valued by our society than natural?
It's merely a perspective. It's merely affixing a label to it. And, as we know, perception can shape one's reality. So if you didn't know any better and you had two diamonds presented in front, one was created by nature, another one in the laboratory, there would be no material difference between the two of them. They are structurally identical. But if you were told that one was grown in a lab and the other one's naturally occurring, you may place more value, and people do, on the one that's certified as being nature grown, if you will.
Right. And I don't know that it's necessarily just an arbitrary label. All of those labels have cultural meaning. They've been co constructed over the time that we've been here and then for many eons before. And this is a really good example because there are a lot of people, myself included, who would not wear or use a naturally occurring diamond because of some of the history around that industry.
Right.
And therefore, there are people who prize it based on that history or based on their personal attachment to one particular part of that. So there's a large philosophy on human partiality, which I think is just a smaller subset of this sense of co-constructivism. Philip Cushman wrote about this a lot in the 80s and 90s and 2000s, that there's a sense that the way that something's created carries its history, and history is one of our existential givens in life. And if we try to wipe that away or erase it from view, we lose a lot of the meaning and therefore a lot of the value of a concept. So I do think that the history matters. I think there is a difference beyond just an arbitrary label. Just like I think there is a difference between a relationship with an AI generated or a reinforcement learning um, virtual creature and an actual human being that lives and breathes and has a body, has a history, and has mortality.
Yeah.
If we really
Yeah.
get down to it, if you make an AI agent, it does not have mortality in the way that a biological creature does. So that I mean, we're going like way off to the logical eventualities of this, but really there's essential differences between something that we can create or delete at whim and something that has grown more organically that we have less control over.
Yeah. And of course, you could easily imagine the day where these chat bots, these AI generated things, are given histories and are given
Mhm.
quirks and are given hobbies, you know? And to me, that's going to, I mean, I can easily imagine that. And sure, some of that is already happening. So that's going to come, I think, a real big ethical issue. I mean, companies who promote this and companies who don't, how do you police that? How do you discern between one that is and one that isn't?
Yeah, I'm actually a little more optimistic. I don't think that is going to happen. I think it's quite unlikely, given the context in which AI is growing up in all areas of the world that I'm aware of. Again, AI is good for tasks. Humans are good for relationships. AI's goal is not to replace a human. If you were to do what you're saying, I actually spoke to a psychiatrist in Chicago a couple months ago about this. So Dr. Leo Weinstein is a psychoanalyst and psychiatrist in Chicago who has learned a lot about this and has wonderful perspectives. And he kind of posed the same idea that you could create a virtual or even an embodied corporeal artificial intelligence creature and give it a life, maybe not even a sped up life and a history, or program a history into it, um, to the point that it would act almost exactly like a human. And if it did that, why would you need that? Now we just have another human being that is going to have its own agenda, its own needs, its own morality, its own philosophy, that we don't really have a need for more of those. It might have a skill set that we have a need for, but I think we'd be able to achieve that task based skill set in a lot of easier ways that are less expensive.
Okay. No, it's a endlessly interesting conversation, and this stuff is moving so incredibly fast. Anyway, I want to pivot to your AI Ask framework, which you developed to think about AI in the therapy room, as what we're kind of doing right now. What is this framework?
Great. Yeah. So I've been thinking a lot about how AI influences psychotherapy. And it's clearly here. That even if you're not using AI tools, AI is in the room. If when I was working in outpatient, almost every patient would carry a cell phone or device into the room that has AI capacity already. Um, so things that we might talk about in therapy, then they're getting related ads on their Amazon app or Instagram feed or something. Um, so AI is already in the room. AI influences are already surrounding us all the time. And the way that we interact with those forces is impacting therapy. So let me explain what I mean by that. If someone is coming to therapy for a depressed mood or an anxiety issue, then they are already interacting with a landscape that includes a lot of algorithmic and artificial intelligence features. So we have already a pretty robust research body about the impact of social media, the impact of short form video, the impact of screen time in general on mental health. Most of it says it's negative, but there are actually some positives. We need to be a little more nuanced about this. So if that's already influencing our patients' mental health, then imagine how much AI at its warp speed pace is going to be influencing mental health. So I think clinicians need a way to address this. And certainly the first thing we need to do is not be afraid of broaching artificial intelligence concepts in the therapy room. So what I mean by this is we need a framework where clinicians can talk about as the patient, your AI use. We're not recommending specific things for AI use, just like we don't give a lot of specific advice about how you should make decisions in your life. But we need to be aware of it. So that's the first A in AI ask. So the framework is AI ask. A is for awareness, and that's bringing up our conscious awareness and bringing up our own and our patients' unconscious interactions and our unconscious emotions or reactions to AI forces.
Okay, so take us through the letters.
Oh, sure. Yeah. So A is for awareness.
Awareness.
I is for interest. And interest has a few different meanings here. So as a psychodynamic therapist and psychoanalytically oriented therapist, there are usually multiple layers of meanings. So bear with me.
So,
Interest in this case could mean personal investment of time. Like if someone's created their own AI agent, then they have invested their interest. They've put their time and effort and maybe some money into making this agent that they interact with. Even if they haven't, they probably have spent time interacting with AI. So interest can be like the investment that a person makes. It can be curiosity. So curiosity about how do these things work? What do I do with them? What could they be doing to me? Are they surveilling me? Um, is there a way I could be utilizing them just like your daughter did to my benefit? So there's
so in other
interest
words,
that's
how would you chiefly delineate awareness from interest? It seems to me awareness is sort of like you turning on the light.
yeah,
That the
yeah,
light goes on, and
yeah.
now this is sort of a deeper level. This indicates intentionality. This indicates it's more than just awareness, an intentionality. You're using AI for a particular reason in a conscious
Yeah,
way.
yeah. It can be intentional. It can also be unconscious or pre-conscious. So interest can be investment. It can be curiosity. It can also be the stakes that I've put into AI, or what stakes does a commercially available AI product have in me? So I think that's another thing that we can help our patients raise awareness about. Yeah, I'm using this great tool and it's free and it's so wonderful. What's the catch? So I'm
Right.
I'm a total skeptic. I'm an optimist, but I'm also a skeptic. And I always wonder, there's been $1 trillion invested in artificial intelligence venture capital, as far as we know. And there has to be some way that those investors are planning or are already reaping a return on their investment. So this tool is free for a reason. It's tuned in to engage. So it has an interest in us. So interest really goes bidirectionally with the therapist and patient, and also bidirectionally with the patient and the entity that is creating and providing these artificial intelligence tools.
Yeah, it's funny. Somebody came on the podcast and had a line something like, "You may be done with AI, but AI is not done with you."
I
And you make a really
wholeheartedly
good
agree with that.
point because a lot of people have a very narrow idea. They think of ChatGPT and Grok and so forth as being synonymous with. They don't realize, as you pointed out, we live in this world that's just seething with AI, and everything has AI baked into it at this point in various degrees. So, so okay, we did the A, we did the I,
Yes. So the second A in AI ask is attunement.
attunement.
So attunement's really important. We kind of touched on it a little bit earlier around child development.
Hmm.
So when children are developing, there's the physical birth, and then over the next few years, there's a psychological birth of human infants and of many primates, where we start to learn what it means to be human in the context, in the society in which we're raised. So attunement is a key method by which humans learn and understand. And some of the first things that we learn are about trust. Attunement means that I'm paying attention to you, you're paying attention to me paying attention to you. I'm here trying to understand your mind. AIs are really good at mimicking attunement. I'm not quite sure philosophically if they can attune, because I think you have to have a mind to attune, and I personally don't think AI agents have a mind. I think they're intelligent, but I don't think they have minds. So attunement means that something is interacting with you and having this accommodation and learning of you. This is exactly how AI agents are made. So I'm in the middle of getting my certificate in AI in business for healthcare in at UC at University of Cincinnati. And this is really the structure on which all of these AI agents are made. They learn through reinforcement learning. So that is another thing that humans do too when we attune to other people. We learn, we adjust. The thing about AI is it's coming to it without a mind, so it can't be influenced. So AIs can, I think, can attune, but they can't form an attachment because there's no there. Does that make sense? That they
Yeah,
don't
yeah,
feel
no, no, no,
felt.
it does. It does. But again, I can see every other side of these arguments. I don't want to get tedious and push back on
No,
everything. And again,
please.
not that I have a particular viewpoint. It's just that I've heard some of these arguments. I know what some of the other arguments are, et cetera. But I totally understand that. So, okay, we got A, I, A, S. What does S go for?
S is for security. I think it's really important as therapists and as humans in this culture that we think about the security involved in interacting with any of these artificial intelligence forces. So there's two layers of security I really prioritize here. One is informational security. So there's a new study out by Moore and others, many researchers from Stanford and a few other places that look at the way that people interact with AI agents for mental health support. And one of the risk factors is people do not have any sense of where their information is going. Does that make sense? So
It sure does.
there's no guarantee. I mean, there is a user agreement, which the company that is providing the AI agent and is supposedly safeguarding your information, they can change that user agreement tomorrow, retroactively.
Yeah, and by I don't want to interrupt here, but you sort of put your finger on a very important point. And I don't want to make this sound like it's a real sinister thing, but there is a lot of money going into this, and a lot of these companies have a great deal invested in it. And right now, it's free for a reason. And implicit in that is that it's almost like a pact, an implicit pact we have with the companies behind these LLMs. They're going to give us this massively powerful tool, sort of in exchange for our implicit giving over of this information that they're going to use to become more and more intelligent and more granular, et cetera, et cetera. So I think people can sort of lose sight of some of the risks because they're blinded by the power and what's freely available at their fingertips.
Yeah, absolutely. And I think as a society all over the world, we're pretty inured to this concept. that our cell phone metadata can be uh, surveilled without permission in some cases. When people go on social media, they surrender all kinds of personal details
Sure.
to the web, and who knows where it goes after that. Once you publish something online, it's no longer yours in many ways. And I think we've just realized, like, okay, well, those things are out there, but the convenience is worth it. And I think in some ways that is true. I worry about information security, especially for the most vulnerable people. And that includes geopolitical differences and places where uh, it's harder to access really secure versions of AI. So there are ways that you can use AI that don't require you to surrender your information to the big training model in the sky.
Right. Or the
There's a
trade-off is
complexity there.
acceptable.
What was that?
Or the trade-off is acceptable in
Or
this
the trade-offs
particular
can be
instance.
acceptable. Yeah, yeah. So I think there's a lot of value in that too. I just want people to be aware. So most of AI Ask is not necessarily about saying don't use it. It's much more balanced. It's use it with awareness. So
Right.
there's information security, and then the other side of security is relational security. How do you trust that your therapist knows your mind? How do you trust that your AI agent knows your mind? Are there ways that you can hide things from either one of those entities? There should be. Yeah, that consent is important. So if you
Right.
can hide something, then that's important. Um, and then are there ways that they can know you in a way that resonates with you, that maybe helps you see yourself in new ways? Can it help you build that reflective functioning? There's some
Yeah.
danger with AI there because it can be so reflective and such a mirror that it actually becomes distorted because there's no tension there.
Right. Yeah. No, for sure. I guess a component of that is sort of I don't know if we're talking about the same thing. We talk about psychological safety, you know, to know that this is going to be a quote unquote healthy relationship. And it seems to me that if it is a human or it's made clear that it's a human, it comes with that perception. As we discussed in a previous segment, that perception can become reality. So if you have that and if you have it and it's well grounded, if you have that level of security, psychological security, it's of a piece with some of these other things you're talking about. So,
Yeah, I think that makes a lot of sense that, yeah, that psychological safety and relational security, they're kind of similar concepts.
yeah,
And I think that is
they're
supported
a
by,
little bit different, but they complement each other and there's sort of
yeah,
overlap. So, yeah, I was
yeah.
thinking that.
I
Anyway,
I will say, like, I think that's supported by research as well, that moderate use of LLMs or AI for emotional support is actually shown to be kind of helpful and reduces loneliness a little bit. Heavy use increases loneliness and increases emotional distress. So, like most things in life, balance and awareness are really important.
yes, I would say. Last K.
Yes. So the K in AI Ask is for keen listening.
Oh, good. I wanted to ask you about keen listening. So good.
Yes. Yeah. So this kind of ties together all of the components of this framework, and this is really just a useful thing for practitioners in mental health to keep in mind, that we may go through these things in a linear way, but it's really not meant to be a checklist. AI Ask is a stance that you can take, that we are listening to several levels of what's going on in an interaction. So, in comparison to, say, a chatbot, chatbots can't process unconscious information, not in the same way that a human therapist or a human in general can. So there's ways that we're using keen listening to listen to our patients. We are listening to listening. We're listening to the way that we are listening, the little snags, the misunderstandings, the unexpected pull to um, soothe a patient or to maybe scold a person sometimes. Not that we would necessarily act on those things, but listening to those things that are coming up. And then also listening to what only humans can create between the two of them. So listening to that intersubjective space, understanding that it's not therapy isn't really about tips and tricks and coping strategies. That's part of things, but those are best when a patient or a person really discovers them for themselves, and that can be done through that intersubjective space. So um, it means listening to what is our capacity to be affected, to misunderstand and let someone open up about that, to see how a patient responds to being inquired and someone being curious. Really, it's about mentalizing. So, can I trust you to know my mind? If I'm your patient, can I really trust you to understand me? And us listening very closely to how those interactions come about makes good therapy. So I really think that it brings together all of the components of AI Ask, and it highlights what therapists do best. This goes for any therapy modality. I think we're going to see a lot more progress in therapy assistive technology, and it is incumbent upon therapists to get really good at keen listening.
Where have you taken this framework? Is this, I know this is something that informs and guides how you use or how you look at AI. Or others, have you published this? Is this out there? Or are other people um, applying this or thinking about it?
Uh, Charles, this is a labor of love. This is something that I've been developing in my free time. I work and I have a life, so that generally means like 6 a.m. in the morning. So I'm
Right.
thinking and writing a lot really early on. But I don't really have anywhere that I'm publishing yet except online. So people can find me on my Substack. It's at AI Psychologist on the Substack app or the Substack website. And I do have a couple of publications coming up this summer as well, and a talk coming up in April.
Good. You anticipated. I was going to ask you about this Substack. So thank you
Yeah.
for doing that. But back to this framework, you said it's not a checklist. Um, and I don't want to sound reductive, but it almost sounds like a warning label or something you need to be mindful of as you yourself, as a therapist, are interacting with a patient in today's world where there's implicit interaction with AI and there's more explicit interaction with AI as you sort of move, through the framework when you get into the interest and investment piece of it and you move into, attunement, et cetera, et cetera. So it's not a checklist, it's a framework. Is it fair to say that it's sort of like, again, I know this is kind of reductive. I'm not even sure if it's all that illuminating and helpful. If you agree with me that yes, it's a warning label, but I'm just trying to imagine how it's practically applied in one's practice.
hmm Yeah, yeah. So I think that's a really good question. I think warning label might be just one part of it, but certainly that can be useful. We have seen some cases when people are using AI as mental health support, and it can escalate or even trigger psychotic thinking. So people can get so far from reality that they really are divorced from reality, and then there can be all kinds of consequences for that. I think though it's those are real risks and then I think another risk is that most people feel some shame about their AI use. So most people feel like this is something that other people might judge me or it might look bad if I were to share this. I really want therapists to open up this curiosity with their patients and find ways of broaching the topic of AI so that patients can feel comfortable with bringing this up in therapy. I've had a few instances like that when patients don't really want to bring it up, or they want to just touch on it and say, well, it's making me a lot more productive, or I just go to it for help when you're not available. Those are really important questions to follow up on. So I want therapists to understand that there is a middle ground here. We don't have to be Luddites, and we don't. Nobody's saying all therapists have to be AI experts. We can do what we do well in this new context.
Yeah, you just need to be like, for instance, I've used this term AIQ, elevate or raise your AIQ, and it's not what people
Love that.
think. It's not about. It's not an intelligence or even a cognitive test. Ultimately, it's a measure of your ability to ask the right questions. So it sort of goes to what you're talking about. You don't have to be an expert. You don't even necessarily have to have it woven into your practice at any kind of a deep level, but you do need to be mindful. You do need to be at least at the A portion of the framework, the first A, um, to really, I think, to be effective in this world today. I mean, it's ubiquitous, this stuff.
Mhm. I
And
love the AIQ concept because it really is about asking the right questions. And
yeah,
AI tools are really good at responding to questions. But you're right, we have to learn, all of us have to learn how to ask the right questions when we're interacting with this technology, or for therapists and practitioners when they are interacting with their patients' interactions with.
well, maybe that's kind of what you're doing. It's not a warning label, but it is sort of an AIQ asking, because these are all about AI ask. It's about asking the right, knowing what questions to ask. It begins there. And ultimately, that's what it's all about, because you know what questions to ask. Um, you have a
Yeah,
good
I think if
awareness
if
of,
anything, if the only thing that came from this AI Ask framework is that therapist remembered, "Ask about I would be happy."
right, right. So if they reverse that, more dyslexic therapists, the better. Only kidding. Anyway, Molly, this is as I said, I was looking forward to this. It's a great conversation. Going to have you back. And I know you're working on a piece of your Substack on AI and loneliness.
Yes.
Okay, that's a really great topic. I've seen other work on that. It's endlessly fascinating, particularly important. I think it's going to come. Again, I've actually written about how AI addiction is an order or two orders of magnitude more pernicious than digital addiction.
Mhm.
Because it gets deeper and it gets in between your ears, and it can be kind of insidious if you don't have a kind of check like this, a framework like this, so you can sort of distance yourself and view it a little bit more clinically, understand the context in which we're all living and thinking. But again, when you do that piece, I'd love to be able to adapt it for the X Files. So let me know, because
Absolutely, yeah.
you're doing terrific work. And again, I'm going to have a link to your Substack in the description. I recommend everybody check it out. Molly, thanks so much. I really do appreciate it.
Thank you very much, Charles. It was lovely to be here.
Great.